Hi, this is Zoe.
And this is Justina.
And this is the Empowered Healing Podcast.
All right. Welcome back to another episode of Empowered Healing. How are you doing today, Zoe?
Doing pretty well. I'm glad to be back.
Excellent. Today we have an amazing guest, Dr. Adrienne Graham. She is a licensed professional counselor in Georgia and a national certified counselor. She's also an incoming counselor educator at the University of Nevada, Reno. And she does so much incredible research on sexual assault, and her clinical focus is also on sexual assault and domestic violence that focuses on trauma-informed care for survivors. So, right up our alley. All right. Well, welcome, Adrienne. Dr. Graham, thank you for being with us.
Hello. Thank y'all so much for having me. Super excited to be here and talk about this really important and, very timely topic.
Yeah. Our last two episodes have been about misinformation and some common topics surrounding all of the misinformation that's happening in general in our country and surrounding cults and high control religions. But today we're going to talk about the LGBTQIA plus population and more specifically the trans community, because how much misinformation is out there right now about trans folks.
Yeah, so much, unfortunately. And it's really sad. And, just seeing so many folks that are affected. And, I have a lot of friends and a lot of folks, where I've done my research who've been affected. So looking at that and, how they just deserve to be treated like human beings. And it's heartbreaking to hear what folks are saying. And just, we've seen skyrocketing just violence, and looking at whether it's self-directed violence, suicide, sexual assault, hate crimes. It's just absolutely terrible. And, looking at various things that I'm sure we're going to hop into a little bit later. And, just looking at how folks can be allies and be supportive of this community right now.
Yeah, absolutely. Oh, we're definitely going to dive into some of the most common and the most damaging misconceptions about the transgender community. Everything from conflating gender identity with sexual orientation, which very commonly misconstrued or made into misconceptions, and moving into myths about transition and mental health and all that misinformation that is really contributing to that stigma, discrimination, misunderstanding, and all of that violence. So whether folks listening are new to this topic, looking to deepen their allyship, or just wanting to learn more, this conversation today is hopefully going to give you a more clear and compassionate perspective on the community. So I'm looking forward to having this chat.
Yeah, absolutely. And I think maybe a good place to start is, kind of on laying the ground of what even like a transgender identity is and how it's different from sexual orientation.
Yeah. Really important to distinguish between those two things, because being trans is who you are, your identity of who you are as a person rather than who you love. So in sexual orientation, that is referring to the people that you want to be with, the people that you are romantically attracted to.
Yeah. Or even emotionally and sexually attracted to. All of that's that external connection versus gender identity being that like internal sense of self.
Yeah. Adrienne, what are some of the ways that you have seen people confuse those two things?
Yeah, absolutely. So I think obviously one of the main ones is where people just talk about how it's just a phase. It's something that, and of course, we always hear the God made man and woman, that's it. And looking at that very binary way when even biologically speaking and scientists, I don't know, people who have whole degrees and dedicate their whole lives to this kind of thing, we know that there is a spectrum, like there is no just two genders. So looking at how folks, view for example, gender dysphoria. Everybody says that everyone who is trans has gender dysphoria, which is absolutely not true.
Right.
Someone who is trans, and the way that a lot of folks have told it to me is that they are like, I physically may have, different genitalia. For example, my biological sex, so to speak, what I was born with, but that's not how I feel mentally. So looking at that, where they're like, I don't necessarily hate my body, even in that perspective, but it just doesn't feel like it's me. So I think that it's so damaging whenever people talk about how trans is gender dysphoria and vice versa, because it's not. So it's one of those looking at how folks are like, I want to be authentically me. And even how we look at, clothing, like boy and girl clothing. So looking at things like that, where it's more about expression and living your true self, where when we look at patriarchy and we look at how folks have been really grown up around the language of everything is just boy girl. So I know that's a long-winded answer, but essentially looking at how I think, and again, as a cis hetero woman in a relationship and married to a cis hetero man, it's one of those things that I've heard a lot of clients and a lot of folks in my research that just say that, sometimes my gender is on this spectrum where I feel more feminine some days, I feel more masculine some days, but being trans means that I am really just living my truth and how I feel, what matches like who I am. Like that's all that it is. That's really all that it is.
Yeah, absolutely. And I love how you mentioned gender identity as a spectrum, because I think that's so true. And I mean, you've seen it across cultures, across history, that like that binary of like man and woman is just that, like it's socially constructed, and that we see in many other cultures that there's more than that, and that they take on either like the two-spirit in like indigenous cultures, that there's usually room for more than just man and woman.
Yeah. And so interesting, like with two-spirit folks, where they're like celebrated, it's like very celebrated. Whereas I'm like, I don't know, maybe we should treat people like human beings. Like,
just the very basic.
What a wild concept. Like, let's just treat people how, the golden rule, treat people how we want to be treated. But alas, we are not at that phase, apparently.
Apparently not. We're not that point of American history.
Right.
Yeah.
It's great.
Yeah.
Mm-hmm.
So when we are dismissing somebody's identity and the way that they want to be addressed and treating it like it's a trend, right? That it's just a phase. It really undermines the experiences that folks are having.
Mm-hmm. Yeah. And kind of looking at that too, again, being in the South, let's just say that being in the South, one, but two, seeing things like where people are like, I don't have pronouns. I'm like, well, first off, you do.
Mm-hmm.
It's literal English, but go off.
Okay.
So looking at that, even where it's like when people act so bothered to use someone's correct pronouns, where what harm does that cause? Like it's just so baffling to me, where I'm just like, you were that deeply just offended and wanting to root yourself, to folks that are like that are rooted in the idea that they're being oppressed by people not following or aligning with their own values and religion typically. So it's like, typical when we see the oppressor wanting to victimize themselves, which is very bizarre in this context, especially because it's like someone saying, hi, I actually don't go by ma'am or sir. I use they, them. Mm-hmm. It should be, oh, okay, sorry about that. Let's move on with our day. But instead, they take it as such a personal attack. And it's just, it is an act of violence. And I know people get really mad when they're like, how is that an act of violence? And it's like, well, think about it. Because somebody is trying to live their truth. They're trying to be true to themselves. And you don't know their story of how long did it take them to even get there?
Right.
So how did it take them to even come out and be able to share that with you? And then here you are just attacking them for that. So it is something that deeply affects people. And being able to identify and say, hey, I am going to affirm you in how you identify, that is like the simplest of things that we can do. And,
Right.
you know, when I was doing my research, so my dissertation focused on positive counseling experiences of transgender sexual assault survivors.
Mm-hmm.
So I would love to say that we have counselors that don't do this, but unfortunately, it happens very often. So some of them even told me, they were like, yeah, you know, some of the harmful things that happened and reasons that I was seeking counseling, it's like I experienced, you know, one or multiple acts of sexual assault, violence, whatever language they used. And so looking at that, they were like, yeah, I went on, you know, typically something like Psychology Today. And, oh, they checked and it was advertised that they're trans and LGBTQIA friendly. And it's like, oh, they were friendly to me. However, what they actually did wasn't competence because they would still dead name me. And a lot of them were like, I understand that legally they had to match my insurance with my dead name or things like that. But instead of broaching that in a conversation, it was just there. And then we never talked about it again. Or they would talk about my past self. Like sometimes they mention like shadow work, for example, and like dead naming them. And they're like, why did we even go there when I wasn't even ready? I've just met you. So even looking at those microaggressions and like things that how people, even if they're trying to be affirming, it's like unlearning how we also, you know, in that cis hetero context, how are we conditioned? Because I still do it. And I know that I still do it. And when people say, hey, you did blah, I don't know if you noticed that. I'm like, oh gosh, I'm so sorry. And let's move on with our day. So yeah, looking at all of that, at how it's just like, I can't even imagine, you know, someone just saying, you're not allowed to live your truth.
Right.
It's just bizarre.
It is really bizarre. And an important term that you mentioned that I don't know that we have talked about or defined is microaggressions. And us as counselors, we know what that means. But Adrienne, can you talk about what microaggressions are for folks who may not have heard that term before?
Yeah, absolutely. So when we look at microaggressions, often it's just these, I like to just tell people that it's kind of a little slight. So it's something that we don't typically, when we're saying or doing it, we might not see it as something that is harmful. A really good example of something that one of my friends told me was because, you know, and again, I know he wouldn't mind me sharing this. He shared it in our class. He's an Asian American. So he worked in a school system and he was telling us that, yeah, even though I'm in this doctoral program, I'm a counselor. I was walking down the halls and someone, you know, I think he said it was like a white man or someone that worked in the school came up to me and asked if I worked in IT. So those assumptions based on race, based on class, based on gender identity or things like that. And, you know, another example could be like, I feel like people have probably done this where they're like going in somewhere and be like, oh, can I speak to the manager? And then even if you're speaking to the manager who might be, you know, a woman, you can like, can I speak to the manager? And I've had it happen where when I was a manager before, like in fast food, someone looked next to me at this tall, 6 foot tall man, assuming the 6 foot tall man is the manager. And I'm like, I'm actually the manager. So yeah, it's like things like that, you know, that we're conditioned and they're harmful for different stereotypes, you know, that we are reinforcing different ideas that have just been taught, you know, and it's not necessarily our fault, but it is our responsibility to learn and unlearn those.
Yes. Yeah. And when you're called out, instead of immediately jumping to defensive of, oh, well, I didn't mean it like that, responding in a way that is a little more humble. You have show some humility.
Yeah, of not only holding yourself accountable, but, you know, getting curious about, okay, what can I do differently? Like, what would be better?
Mm-hmm.
Simple as that.
Yep, exactly. Exactly.
Same concept, just like you mentioned, Adrienne, with, all right, I screwed up and dead named somebody, or I screwed up and used the wrong pronouns. Owning up to it, apologizing, and correcting your mistake goes a long way.
Yeah, absolutely. And I mean, again, one example, I was literally doing my dissertation and I had all of their, like, names that they gave me and things like that. But some of the pronouns on there that people used, I had never used myself before. So I kind of, instead of assuming that I knew how to say it or what they preferred, and during the interviews, I would catch myself where I would accidentally say, they for everybody because I'm like, oh, that's safe. But I would try really hard to like have their pronouns right in front of me so that I wouldn't unintentionally mess up. But I did tell them, hey, I am unlearning and I just want to let you know, please feel free to correct me throughout this process because I never want this to be harmful for you. And I even told one of them, I think they use zir. And I was like, I've never used this in conversation before. So I apologize. And I asked up front, I'm like, is that the right way to say it? So being upfront and, not necessarily in that, oh, educate me and that burden is on you. But it's like, I was just like, hey, I might butcher this pronunciation and I'm sorry, but being able to just say what you don't know, but it's also on us to be able to say that is our burden to educate ourselves too. And I think that gets sometimes tossed out the window. And, again, what I've seen, because I did direct clinical practice during my doc program while I was getting fully licensed here in Georgia. And so I was in a few group practices, but looking where, even outside of those group practices, it's one of those things where I think sometimes, counselors, social workers, and anyone who's doing individual counseling, sometimes we get so siloed where we forget that we do need to do a lot more intentional work where, again, we know we have to get CEs and all that stuff that is a lot for us to be licensed, but the intentionality that we take on what are we doing to truly educate ourselves and looking at those gaps that we do have, where I think sometimes it's just, let me get the CEs, I'm good for another few years, okay, bye. Which, again, I get it. We've all been there.
Sure, but that gives you so much opportunity to expand your breadth of knowledge.
Yes, absolutely.
Yeah. And talking about in counseling context, so we're seeing a new client for the first time. It is never harmful to say, hi, my name is so-and-so. What is your name? Excellent. What are your preferred pronouns?
Right.
Just make it a part of your standard intake process.
Yeah, absolutely. Like normalize it.
Yeah.
And if they've never been asked that before, who knows? Maybe that starts something for them as well.
Yeah. Minimally, it opens up a conversation and gets the gears turning.
Yeah. And I love that you mentioned that. So I don't know, Justina, if you've seen this, especially in supervision, but I know I have, where people are, folks who are either getting licensed or they're finishing their master's degrees. They're asking, like, what do we do with note taking? What are we doing to protect our clients? And, I think everybody gets really scared about, things being subpoenaed and stuff like that. And looking at, what I generally say is the ultimate goal is we are protecting our clients. Yeah. So if we have trans clients, I am upfront. I am always upfront where I'm like, hey, what is on this paper is to protect you in case anything were to happen. But in this space, I am going to call you, insert what their pronouns, what their name is, and things like that. And just being upfront and broaching that, because right now, I'm not going to lie, there are so many unknowns with our profession that it's genuinely scary. And it is very scary for our clients, where at the end of the day, we owe it to them to be give them that transparency, but also to be able to say, like, hey, these scary things are happening right now. And I want you to know that, like, this is how we document here. This is what it looks like so that you're protected.
Yeah.
Because, there's just so much right now. And looking at how not only are there bans on bathrooms, on trans athletes, and it's just like, like what? Like the whole
So much unnecessary energy to be hateful.
Right. And like, oh, there's like, I don't know, fewer than 1% like trans athletes that you're going after. And I think it's Pedro Pascal who said it. You're going after, it's so despicable to go after some of the most vulnerable people in the population who are just trying to exist. And it's so true.
It is.
Like, it just is baffling that people are just so dedicated to their own hate for whatever reason.
Yeah. Yeah. I think there's a lot of stigma and misunderstanding as well with the pathologization of trans identities and of gender dysphoria. That first and foremost, gender dysphoria is not a mental illness, so we can get into that. But also that you mentioned earlier, Adrienne, one of these things is not necessarily the other either.
Mm-hmm. Right. Yeah. The amount of people, the Facebook warriors, typically, who look at trans folks and they're like, oh, they're mentally ill and da 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 and all this stuff. And it's like, actually, one, you're not.
Been disproved.
Yeah.
So many times over.
Right. And it's like I've seen so many people who are like, they have gender dysphoria if they're trans. I'm like, no, they do not. Actually, they are not the same thing. Like, that doesn't, and it's just one of those things where, even with the expertise that you have, people are just still so dedicated to one misunderstanding, and they are not willing to be educated. And so part of that too is like, I like to ask myself, where is my energy best spent? So with that, I think, and again, I might be wrong because I'm a cis hetero white woman. I acknowledge that. But looking at part of it is always calling these folks out, and also really ensuring that we're asking folks in these communities, like, where can I be? And the way that I explain advocacy is sometimes I think that people can get I'm going to go in, swoop in, and save the day. However, I think uplifting the voices of those impacted is what we need to do. And by that, it's asking the people that we're serving, what is needed? How can I help with my license, with my expertise, with my time, with my research? How can I do that to help these organizations, these people, what is needed? And even looking at bans on research right now, like, okay, like, you can try. It's like, you can try, but at the end of the day, we'll just change different language or make up other terms. It's like, I'm not going to stop doing what I'm doing. So how are we able to help with those different gaps on much needed research? And so, fun fact, now they're trying with domestic violence shelters, they rely on grants.
Yeah.
Straight up. They rely on government funding. So looking at that, where they are right now trying to sign things where it says, trying to label things as violence against certain populations. And if places do that, they're threatening to strip funding. And then also, shocker, banning trauma-informed care in the language. So it's one of those things where it's like, what does this look like? And how can we uplift these different places and what's needed? And I think that it is one of those things where we're going to have to look at, community, like, even if that means looking at helping with fundraising, helping with volunteering your time. Like, what does this true advocacy look like? Because all of these places and all of these people need us. They desperately need people to be in their corner.
Yeah, absolutely. And I think as counselors having the conversations that we're having now, even for other counselors to say, hey, sitting with someone, beginning a relationship, let's start here. And I think it's so important to also introduce, okay, we are going to use your insurance here. This is what legally your insurance card says. This is what is on your current identification. This is what I have to send into your insurance. Letting folks know that up front really prepares them to combat against some of the distress that might happen when, that explanation of benefits comes in the mail, or they see something in their chart like, oh, I thought this person was on my side. Having that conversation up front, saying, this is the legality of what I have to do. But like you said, Adrienne, this is what we have to do. But in session, you are you. I'm going to respect your identity, and I'm going to use that here. And continuing to revisit that as needed, that it's not a fixed one-time conversation.
Mm-hmm. Absolutely. Absolutely. Looking at safety, I do safety planning and teach people how to do safety planning, where I think sometimes we can think about when that comes to mind, physical safety, obviously very important, but even looking at emotional safety. So we know as counselors, they're not going to have 24/7 access to us.
No.
So looking at how can we help them to feel emotionally safe? So what does that look like? Like, oh, after this session, because it was really hard, what are your plans for the rest of the day? If you get activated later, what is your go-to? What does that look like? And looking at, the safety of that. And then also talking about safety when these acts of violence happen. And like one of my participants even said, when they were like, I could have an excellent counseling session. I could deconstruct all of the violence that I have experienced. But at the end of the day, whenever I'm sitting there and talking about grounding techniques, it's not going to help if I'm hate crimed when I leave the office.
Right.
So being able to look at acknowledging that these things happen. And often we also look at, folks who are in any marginalized community. Typically, they have a distrust of systems and especially of police. So building in safety plans, sometimes calling police might not be an option.
Definitely not the safest option.
Yeah. So it's like looking at those warm lines and doing work for, hey, maybe this place specifically, and I apologize, can't remember off the top of my head, there's a few where, especially for Black trans women, they don't call the police if there's a mental health crisis, things like that, because we know Black trans women are unfortunately killed at higher rates of really anybody.
Than anybody. Anybody.
Yeah. And looking at, specific for sexual assault, and again, I like to always highlight that a lot of statistics are probably higher because we're just getting data from those who feel safe enough to report. So even right now, and I think this statistic is from 2019, so not too terribly old, but looking at, unfortunately, some data is pretty outdated. At least 47% of trans folks have been sexually assaulted at some point in their lives. Yeah. So looking at those statistics, and then unfortunately folks in the LGBTQIA and trans communities, they experience corrective rape. So what that is looking at rape who the perpetrator is trying to quote unquote correct the survivor. And again, I use survivor instead of victim, but I always open up language to what who I'm working with prefers. Right. But looking at, they think that that act of violence is going to correct them into acting right or in their how they look. So, things like that, where that is something that is unique to this community where cis hetero folks will not experience corrective rape. So being able to look at those things and unfortunately being able to understand what it means for these communities and how we can support them in that, because it's so much to even unpack just that happening.
Yeah. And as we're talking, the overall arching theme that I see is just like how important safety is for this community in general, and how that's something that is always on the radar that, they have to navigate, like when, how, who are they sharing like parts of their identity with, and that it's less about like, can I be authentic and open in the space, but more about being safe. Is it safe if I share any part of this identity with the people around me or in this space?
Yeah. And funny enough, now that you mentioned that, Zoe, looking at all of my participants, so I had 8 participants in my study, and almost all of them, pretty much all of them had said that they had expressed to a previous counselor that they were, thinking of either harming themselves, they had suicidal ideation, insert one of those, and they were just immediately hospitalized. So I also think that it's one of those things that I don't think that a lot of times, let me back up. So I think sometimes people get so scared to, I say, protect our clients, quote unquote,
Yeah.
when they don't think of what that means. Taking someone's autonomy away, taking their control away, and just hospitalizing them is sometimes more traumatic than helpful.
Oh, and I think especially considering just overall healthcare, like emergency healthcare in our country at present is not the greatest. And so, yeah, I think like re-traumatization or new trauma, extremely likely.
Yes.
And I think especially for more vulnerable populations who do face the constant stigma, even in the medical field.
Yeah. And even just thinking like, I can honestly say I can't think of any place that is safe to hospitalize a trans person. You know, it's like that is they're such special needs that, you know, they're probably going to get denied a lot of affirming care in those types of environments, and harmful diagnoses that will follow them, you know, that may or may not even be accurate. And even looking at folks who are trans advocating for themselves and that being viewed as combative or resistance or not ready for change and things like that. Whereas it's like, according to who?
Yeah, exactly.
Yeah. Oh, so much.
Mm-hmm. There's so much wrong in general with our mental health care system and hospitalization and trying to allegedly prevent harm. And there are some places that do have inpatient care that are trying to do better and offer gender affirming care. However, like you said, Adrienne, that is not the norm, especially for people who are seeking emergency mental health care.
Mm-hmm. Yeah. And looking also, it ties directly into, you know, there's a trans legislation tracker. So I highly recommend people look at that. It's just translegislation.com. So you can look at different things in various states, you know, that are being passed, are on the docket. And unfortunately, with this current administration, it's just increasing. And we know that there are a ton of states that are just kind of falling in line. And so looking at that, where it is more the responsibility of folks who provide care to, one, be aware of these things. However, it's also something that is going to scare a lot of people into like, what do I need to report, not report, and things like that, which fortunately I've seen a lot of people who align with me where they're just like, nope, I'm protecting my clients, period. But you have some people that are more, you know, and it's very real where they're like, I could lose my license and all of these. And I think true advocacy means putting those things on the line, period. Like that's what it means. Like that is what it means. And looking at the decolonizing stances and looking at what does it truly mean to be an ally and what am I willing to risk? What am I willing to risk to be in this field and to be able to do what I do to help people who need it?
Yeah.
And again, not trying to hop in as like a white savior, but looking at like, you know, a lot of folks are like, you know, I've seen leaving certain organizations, leaving certain state organizations for licensed professionals because they're like, hey, like you have not said anything about these things. You haven't taken a stance. Why should I continue giving you membership funds?
Right. Right. Yeah. And we're talking overarchingly about politicizing trans existence and creating all of these bills that feel so arbitrary and unnecessary. There are so many risks in doing that, in politicizing just folks being able to live, in treating identities or rights of trans folks as debatable issues instead of human reality, that these are people that we're talking about. They're not some arbitrary fairy tale figure that is the boogeyman. These are humans who are just trying to live their lives. And this is about human dignity and human rights and not about ideology.
Right.
Yeah. And I think to your point, when you politicize it, like it strips that part away. It strips the humanity away that it frames them more as like social issues or political issues versus these are just people who are trying to access the same thing as everyone else. Healthcare, mental health care, regular doctor visits. It's just like, it's all of those things. And so when you frame it from a political lens, it's the idea of, oh, do these people deserve the same access or not? When in reality, like, we all deserve the same rights.
Yeah.
For all people.
Yeah. And even looking, right now, for example, we have Georgia House Bill 660 that was introduced. So for this, it is, verbatim, it says, on or after January 1st, 2026, the state health plan shall not include expenses for any transition-related intervention. So it's looking at employees' insurance and benefits, public assistance. So it's like, essentially, you were looking at people's identities not being worthy of care, period. And it's just one of those where it's like, the way that I like to tell people, it's like, oh, if you have any kind of plastic surgery, actually, that is gender affirming care. That is gender affirming care. But just because you identify as cis, it's okay.
Yeah, that was exactly where I was about to go of, let's talk about what gender affirming care actually is and what it isn't. Because gender affirming care is not having surgery to affirm someone's gender. It can be that, sure, but that is not all. Things like Viagra for men to have sex is gender affirming care.
Yeah, exactly. It's insane. Like, it's truly insane when you think about it. I'm like, why do we care what surgeries people are or are not having?
Yeah.
And it's a personal choice, kind of like where it's like, oh, I wouldn't have you go and have a boob job, that's gender affirming care.
Yeah.
Period.
Breast augmentation is not on the docket.
Yeah.
I have no faults with anyone having any type of cosmetic surgery, and that's what it is, whether you choose to have some type of cosmetic surgery to help you improve your confidence based on affirming your own cisgender identity or a trans identity. There is no difference in gender affirming care.
Exactly. Like, it is literally all gender affirming care. And, it's just bizarre. And looking at how legislation directly ties in with fatal violence that trans and gender nonconforming folks experience. Because when you have people in power who are looking at control, they open the doors and make it normalized and okay for people to spew hate and harass this entire population, when in reality, there's still, even though there's such a small percentage of the overall population, they experience more violence than anyone else, just about. And then when you add in other marginalized identities like queer, Black, Indigenous, like, even more. So here in Georgia, it's like, down the street, we had a Black trans woman who was murdered on a walking trail, and it was not even in the media. I think there were like 2 articles and that's it, period. And so it's just like also that invisibility, and just when we look at justice, it doesn't exist often. And so sometimes what I like to tell people is, for survivors, I'm like, they often have to think, what does justice look like to them outside of the legal sense of justice? Because often justice is not going to tie into the systems that oppress. It's awful.
We're talking about these policies being enacted. We, Zoe and myself, are in North Carolina, which was the original state several years ago, which introduced the bathroom bill, where you had to use the bathroom that was assigned to the gender that you were given, gender, sex, that you were given at birth. And that, at the time, I remember feeling like it was so extreme and so insane. And then we fast forward to today of seeing pieces in the news of people who are being dehumanized and violated in bathrooms who are of that sex. So women who appear masculine in bathrooms who are being literally, physically, and verbally attacked because people are assuming that they are not cis women.
Mm-hmm. Yeah.
And that is the increase in violence because of this legislation. There is a direct correlation that the number of bills that are being introduced and enacted, you can see the clear correlation of violence increasing substantially with all of these policies coming into play.
Yeah, and I mean, when you have like anti-trans legislature or otherwise like hostile rhetoric, like you said, like it has real world consequences. And even on maybe a less significant note as far as like maybe not actual violence, but you see institutions then start pulling away their own policies because either they were never about it to begin with, they weren't actually supportive, or that now they're afraid. And an example I had during my time at Clemson is they removed all menstrual products from the men's restrooms, which they had for years. And then all of this anti-trans stuff started popping up and it wasn't there anymore.
Yeah.
And the school made no announcement about it. They just quietly removed all of them from every restroom across campus and hoped no one would say anything. Obviously, that didn't happen.
Right.
The queer communities on campus obviously made us think about it. And I think that year was the year that Clemson started their annual, there's like a queer walk that they do once a year, kind of in recognition of that. Clemson isn't standing up for all of their students like they say they will.
Yeah. Yeah. There's a lot of, not even just in educational institutions, but institutions in general who claim allyship, but their actions say otherwise.
Yeah. Yeah. And I think looking at, the overall, my favorite argument is, oh, well, trans folks are just trying to get into the women's restroom to cause harm. And I'm like, wait, so are we actually talking about cis men wanting to cause harm?
Yeah. Yeah. So I had this conversation with a criminal defense attorney friend of mine recently who often charges folks who have murdered, raped, done all sorts of harm to folks. And I asked him flat out, how many folks in your 20 plus years have you charged in any of these crimes who were trans? Take a wild guess at how many. Zero. Literally zero.
Yeah.
In nearly 30 years of practicing criminal law, have charged zero trans folks with any type of sexual violence. Any.
Yeah.
It is such a false narrative.
Oh, absolutely. That just makes me so mad.
When cis men are the ones out here causing violence not only against trans folks that we've been discussing today, but causing violence in general, causing sexual harm to folks, causing physical harm. And those are the folks that are out there murdering people more than anyone else.
Right. Yeah. And, when we look statistically too, even the violence against trans survivors of sexual violence, guess who? It's usually the yes, exactly. Corrective rape, cis men, typically.
Well, those aren't conversations we're ready to have, apparently.
Yeah.
Yeah, absolutely. And, even looking at different universities too, and what are they doing to step up, or are they falling in line? And, I think when we talk about, academia and looking at the ivory towers, how are we also looking at, again, for me, it was kind of looking at that, what is a good fit for me? what is a good fit? And that's kind of, again, I know we were talking about me moving, like, and looking at where am I going to end up, but looking at how are institutions either falling in line or how are they truly stepping up to truly protect the most vulnerable on their campuses and in their communities. And I think that it is important where there are going to be people who are on college campuses who, if there's anyone who does, collegiate level counseling or you counsel folks in that community, there's going to be a bigger level of fear. And I know there already is, where you don't feel safe. Their organizations are being stripped away from them, where they're literally saying, we're going to cut funding for X university if you do not do away with your LGBTQ resource center or anything like that. And they're even catching wind of people, or rather, universities, like, how are you trying, if they're trying to rebrand, like, they're still threatening them. So it's one of those, like, being under a microscope and looking at, truly, it's all about control, looking at control and money and looking at power and looking at how are we also contacting our own legislators? How are we contacting them, being like, hey, you work for us, actually, and reminding them that these things are not okay. And I think right now it is one of those things that I mentioned, and we've been talking about this entire time in the unfortunate times that we're living in right now, looking at how are we falling back on community and getting more involved with these communities that we might not be members of ourselves, but what does allyship look like?
Oh, trying to refocus here, not spiral into anger.
Yep, same.
Oh, so just coming back to trans rights in treating trans rights as political polarization just turns support for basic human dignity into a really divisive issue. Radicalization in undermining civil rights. It is something that has been used as such a politicized issue that has become a huge distraction tactic for broader political agendas.
Oh, it's a total diversion tactic.
Yeah.
Like, let's use this, the 1% of 1% of the population as a scapegoat while other bigger significant issues are happening. We're going to use this small population. We're going to focus all our energy on them.
Mm-hmm.
And for what?
The othering tactic.
Kills this time.
Yep.
Right. It's truly just disgusting. And even when we look at, I think just us in the field that we're in, it comes with a lot of responsibility. And I know I've mentioned this already, but looking at that responsibility of being able to step up and say, hey, I need to be an advocate, because I get this often. And I don't know if y'all do. I'm pretty sure you probably do. And again, as a professor, I've had students where they're like, hey, like, isn't advocacy more social work than counseling?
No. The answer is no.
Absolutely not. Like, if you even look at how counseling came to be, it is what we should be doing all along. Like, without advocacy, we're not counseling. Without human rights, we're not counseling.
Right.
Without basic respect of dignity, we're not counseling. So looking at that and how, again, as someone who typically, I'm always going to infuse, coming from a feminist perspective, but in the sense now of where I even know what we learn in counseling programs is very white centric. Mm-hmm. So also looking at the decolonizing practices and how are we learning from Indigenous and queer and Black folks, those other folks. There's a great book that I actually just got called Decolonizing Therapy. And I'm really excited.
I had my techniques folks reading that.
Oh man, I can't wait to start reading it, because I know, even as a counselor educator, for example, I like to just tell students and infusing, hey, you need to question everything because, yes, you are learning here what you need to learn to get your license to be able to practice. You're learning skills, you are learning techniques, but you really need to look at how the DSM came to be. You need to look at how theories came to be. You need to look at how all of these things in this field came to be, which when we look at a decolonial lens, we are taking and uplifting the voices of folks who are not just the cishet white men who came up with all of these things and used it as a way to other women, how to other Black folks, how to other Indigenous folks, and how we take that in context when we look at diagnosis, when we look at how are we doing treatment planning and how are we really collaborating with our clients? Because, we can't sit there and say that this is true to our clients and not take in their full context and say, oh, but I learned this in my master's program. Like, great. Yes. Looking at oppression, historical trauma, politicizing, because the personal is political. And so therapy should be political, period.
Oh, yeah, absolutely. And obviously I'm newer to the field than both of you, but even, in my year outside of school, just how much you have to do for yourself to learn and be an effective counselor is insane. Like you pointed out, Adrienne, that, if you learn the stuff, the bare minimum you need to get that license and head out the door. But from a systemic perspective, from a feminist perspective, you learn surface level terms. You can throw out intersectionality and, all of these things. But are you actually walking the walk? Do you know what that means? Do you know what to deconstruct that is?
Are you putting it into practice?
Yeah, absolutely.
Exactly.
I don't teach you that part.
Fortunately not.
Yep, exactly. Where, and tying that in with trans folks, if we look at a non-decolonial lens, I don't know if that's an actual term, but whatever.
It is.
Okay. So if we look from just the lens of what we have been taught from this othering perspective, even in the counseling field, it's like some people are so dedicated to, well, the DSM says da 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 da, where they'll still fall on, oh, gender dysphoria equals transness. But it doesn't. Where being trans in and of itself is not something that is a disorder, which is the very common argument. Looking at gender dysphoria, if someone is trans and they are saying, I have a male, I look male, like that does not match with me feeling like I am a woman, where and it goes deeper than that, but that's just the very surface level example. That is an example of where we could be erring on gender dysphoria. However, it's it still takes a lot of assessing and a lot of conversations with your clients to truly be able to identify gender dysphoria, and even assigning right now for anyone under 18, assigning gender dysphoria itself is going to cause harm. Period. Because it is looking at criminalization from that. So looking at that decolonial lens where it's I might just put adjustment disorder, for example, instead of I'm going to label it as gender dysphoria. Even if it's showing up, I might say, hey, let's talk about this and really delve into what does this look like. And people who are trans don't always have gender affirming surgeries. It can also look like social transitioning. And that's freedom of expression, where your name could be something completely different that you were given at birth, but us calling you by a name that you identify with, that's not crime. It's not something that's illegal. And even when we look at, drag performers, people assume that folks who do drag are always trans too. And I don't understand that at all.
Yeah, not either. Not at all.
No.
Yeah. It's just the othering.
A drag performer or a trans person without telling me.
Right. It's just what is outside of the binary and the othering. How can we other them and look at it as weird? It's not quote unquote normal. It's disordered. And, so many Google researchers, get out there and say that this is a disorder. And I'm like, actually, no.
Actually, not so much.
Exactly.
So I important point that came to mind while you were just talking is let's reel back a little bit and talk about why, at least for me, and I don't know that it's the same for you guys, but I imagine it is, the reason that trans folks typically come to therapy. I can tell you I've not seen one trans person who's come to therapy because they're trans. They've come to therapy either for, sure, I am experiencing gender dysphoria and I'm trying to understand what this means for me. And gender dysphoria meaning that my gender identity doesn't align with my assigned sex, and that's causing me distress. My identity is not causing me distress, but I need support with how to make sense of this for myself. I'm not coming to you because I think there's something wrong with being trans. It is how to function in society and feel okay functioning in society and feeling like I can be me.
Yeah. I mean, really, at the end of the day, a lot of like the trans people I've worked with, it's more about like their identity of like, how do I explore this? Like, in what way feels authentic to me?
How different is that than any other client that we see?
Yeah, it's like the same thing. We're all figuring out how to be ourselves and how to, live a most authentic life.
Right.
Yeah.
Same thing.
But although when I see cis women, a lot of times trying to sort out their identity and who they are, the thing that they are not experiencing that trans folks are is the level of distress because of what they are facing in society typically. Of course, all of my clients experience that to some extent, but for trans folks, those are the folks who are being attacked in legislation by political figures every single moment of every single day. So they have an increased level of distress, justifiably so.
Yeah, absolutely. I mean, it's everywhere all the time. And like, unfortunately, it's probably just going to continue to get worse under this current administration.
Yes, unfortunately. And even, I know y'all have probably seen this too, but I get so vexed every time I get on any social media and there's it's always a white, quote unquote, feminist comparing what's happening to The Handmaid's Tale. And I'm just like, look, you are just now bothered because it affects you.
Yeah.
But in reality, this has been affecting, like when we look at reproductive health care, for example, this is something that has been and always affects everybody. And that also ties into affirming care for trans folks, because not only are they not able to access, if they need any kind of care, it also raises flags about, is someone who, quote unquote, presents as male being able to go to a gynecologist to receive care. So what does this mean for trans people too? So it's like, there's also just everything is interconnected. And unfortunately, a lot of people don't realize until it starts to affect them that it's been affecting these other folks for so long, but they never said anything because it doesn't affect them directly. Right. And that's a huge problem, especially with the white feminist movement. And again, I'm a white person myself. I had to unlearn a lot of this. Shout out to a lot of Black folks, truly Black women who have been the forefront of the reproductive health and justice movement. That they always do and have always done the legwork literally with their bodies, their blood, sweat, and tears. And the fact that they are never discussed when these topics come up, but instead we have people talking about, it's like The Handmaid's Tale. It's like, it's been like this for people not like white husbands.
Yeah. These experiences that we're watching play out in The Handmaid's Tale, which is perceived by so many, especially white women, to be such a fictional, this could never happen type of story, when this has been happening to Black women in our country for decades. Yeah. This is not a made up experience. This is happening. And this is diverting from the trans topic a little bit, but in your state right now, Adrienne, down in Georgia, a Black woman who is being treated as an incubator right now.
Yes. Adriana Smith is a brain dead pregnant woman. She was a nurse. She went to the doctor when she was having headaches, for those, who haven't heard this story. And after that, shortly after, she essentially was declared brain dead in a coma. And instead, because of the restrictive abortion bans here in the state, the doctors will not allow her to pass, even though I think at this point, and this could be me misspeaking on accident, she was either 9 weeks when she went to the doctor.
She was 9 weeks when she was declared brain dead, and her parents were not allowed to make the medical decision to allow her to peacefully pass. The state stepped in and mandated that they have to keep her body physically alive with the use of machines to grow a fetus, despite it only being 9 weeks when she passed.
Yep. And looking at these things too, where I don't know why it is leaving me about what it's called when you can fill out forms, leave it with your doctor or whatever for your wishes. It's not a will. It's
your medical proxy, your power of attorney, all of that. Typically, you have somebody in your family or a spouse who has those rights.
Yeah.
Her parents have those rights, but because, like you said, those restrictive laws in Georgia, the state is somehow allowed to step in and say, no, this woman is going to grow a fetus, despite the fact that she is not going to be alive to care for it. And not only that, once that baby is born, if it does make it to term, her parents do not have rights to that child.
Yeah. And I just remembered, so in Georgia, it's called an advance directive. Okay. So it's a form that you can fill out, and every state might call it something different. So there is a section in Georgia's advance directives where even if you're like, here are my will, here's everything that I wish to happen to me, my body, anything that happens, and I can't make decisions for myself, there is in fact a clause about pregnancy, where in case of pregnancy, that under Georgia law, that there is essentially like, it's almost like it's null and void, where if you're pregnant, if the fetus is viable, the state has call, essentially. So looking at how can you even, looking at what is happening with Adriana Smith and her poor family, just wanting her to pass because let's be real, this is once again a Black woman's body being experimented on to see if a fetus is going to be able to be viable with her body without her consent. And looking at, again, the intersectionality of violence, where anyone who falls in marginalized communities are disregarded, period, with these laws, with bans, with anything that's happening, and where folks need to step up is realizing that even if this doesn't affect me today, this affects everybody. Yeah. And I think that's a huge problem, that some people don't start acting until they think that it might affect them.
Yeah. I think that is the biggest point to bring this all home, is that even though trans folks make up such a small portion of our population, because we are not trans, that does not mean that it shouldn't matter to us.
Period.
Human rights are human rights.
Yep. Plain and simple.
Absolutely.
It's just crazy that we even have to have that conversation.
It is crazy. And it is crazy that we could probably talk about this for the next 48 hours straight and not even begin to scratch the surface of the broader issue. But the most important parts to really highlight are that politicization, that this is detracting from real issues, that trans folks are not out there causing harm. They are just trying to live their lives, and they are the people who are experiencing the most harm.
Yeah, and that in our role, in our capacity, like, it's part of our duty to be able to amplify those trans voices, to give them a space to talk about the impact that our society, our systems are having on them.
Go back to that very first episode of going out of your way to hear things that might not align with who you are or what you necessarily believe, I think that is also an incredibly important point, to go out of your way, seek out listening to trans folks and what they have to say, listening to the stories, listening to those voices, actually understanding what their experiences are like and not what you're being told they are.
Yeah.
Mm-hmm. Absolutely.
Yeah, and I think even expanding on that point of not putting it on trans people to explain everything to you. If somebody's out there speaking their truth, like, listen to it, whatever. However, it's not their responsibility to educate us. It's our responsibility to educate ourselves and listen as much as possible and gain as much insight as possible. How can we show up the best way for them?
Yeah, absolutely.
Our fellow therapists who are listening, we talked a lot about legislation and legislation that's happening on a federal level and also in our states, but this is happening in states across the country. And Adrienne, remind me of that website about is it just translegislation.com?
Mm-hmm. Yes.
Excellent.
That. And yeah, I was going to say another thing is, a lot of people that I know looking at keeping up with the World Professional Association for Transgender Health. So WPATH, as you see it, is another really good one.
Excellent. I'm going to put all of these things in the show notes so you have easy access to click on those links. But for our fellow therapists who are listening, for you to be advocates, for you to be allies, politicians don't know what they don't know. If you are not showing up, they don't hear your voice. If you are not calling, if you are not emailing, they do not hear your voice. When politicians are voting on bills in your state, those are public. You can show up. You can speak. I highly suggest, if this is something that you have the capacity to do it.
Period.
Absolutely. And even finding more accessible ways to show up that maybe you can't show up physically, but there are ways that make like calling easier, because it can be a process, obviously, finding the right numbers and, going through all that process. But there's this website called 5 Calls. And so it helps constituents like call their Congress people.
You just put in your physical address and it links you to who your politicians are that you have elected. And it connects you with ways to contact them, whether that be by preformed emails, by phone, but it does the majority of that legwork for you. That's a great resource. Thank you for reminding me of that.
Yeah, of course.
Again, we can talk about this for the next week, probably. But final points, anything else that you feel is important to add today, Adrienne?
Yeah. Well, first off, thank you all so much for having me. This has been amazing. I would just, kind of hit everything home with, keep doing the work, keep showing up in community, keep asking those that you are serving, whether you're a counselor, educator, counselor, whether you are doing research, whatever that looks like, keep showing up and asking the communities, asking the people you serve, asking these marginalized folks how we can show up and how we can uplift their voices through research and whatever we can. And, us as supervisors, us as teachers, how are we showing up and teaching about trauma-informed care and talking about protecting these vulnerable populations? So I think that's really kind of the main thing too, and keep yourself updated, be safe, and also being able to stay in the fight, because it's going to take all of us.
It is. Thank you, Adrienne. We appreciate you coming on today. And I'm sure we'll be asking you to come back to talk about more in the future.
Yeah, I would love to anytime.
Thanks.
Thank y'all.